Let this go. Good. On your back. Good, now let it all go. There you go. Hey everybody, this is Dr. Warren here at Kalkstein Chiropractic. I'm with Cassie, and Cassie, you've been seeing my dad for a little while, and then when I graduated in 2018, I think I started seeing you, I don't know, maybe a couple years after that or soon thereafter.
Yeah, it was right before COVID.
You trusted me enough to give me a shot, and you've stuck with me ever since, which I appreciate. You come in on a routine basis, right?
I do. You have magic hands.
Oh, yes. Appreciate it. I wasn't expecting that. Let's go. Love that. No, I'm grateful. It's a pleasure to get to work with you and your family too, honestly. Yeah. It's been a lot of fun. So tell me a little about your experience in the past and what brought you back in and why you do come in from a chiropractic standpoint.
So I've been struggling with chronic lower back pain since I was 14 years old. I sprained my back, and then it resurfaced again in 2016. And after seeing an orthopedist, I was diagnosed with a bulging disc and some arthritis, and I take anti-inflammatories on a regular, prescription strength anti-inflammatories on a regular basis to kind of help take away that discomfort. But I've been coming to Warren more recently for some help with dry needling and a bunion on my left foot, and that's been helping a lot. And then I also just come in also on those days that I do dry needling for a readjustment to help with the lower back pain.
Okay, how has the low back been? How have you been
doing? It's been a lot better, but after this weekend, it's a little rough.
Yeah, life comes at us in different intensities at times, no doubt about that.
Yeah, life of a photographer. You're always bending over, standing up, carrying stuff. Yeah. You just take a load of it.
The fall is definitely a busy time for you as well. So there goes into. Well, I want to digress to just talking about how she's taking care of herself and her chronic back pain. I mean, this is a long time, and your body, unfortunately, with pain, can start to get a little bit used to it. It almost becomes a little bit, you just kind of own it. People own certain types of problems for sure, but as it relates to pain, it can almost be like a message that doesn't go away sometimes. Let's call it that.
Absolutely, I definitely agree with you. And I after I hurt my back in 2016, I basically lived with chronic back pain for 2 years before I actually did anything about it.
Sure, that's
and I was just like,
easy to do something when you're hurting like
because when I was getting ready to go overseas on the long distance hike, that's when I finally decided it's time to get my life back.
Yeah.
So seeing an orthopedist every year, going for annual checkups, and coming to see you has definitely been.
I'm grateful to be a part of that process, and what she's not mentioning is that she's very active as well, and she takes care of herself on a routine basis. It's not like, oh, it's fall time or it's after January, it's time for me to do X, Y, and Z. It's just very consistent. You take care of your health,
yes.
And I think that plays a big part in it as well. So I want to speak to that. On top of what you mentioned, right? So with her low back and with the disc injury she's had when she was younger, she's definitely, her body is kind of moved on from that, but the pain hasn't, right? And so we're treating her functionally from a movement standpoint, adjusting, doing soft tissue when necessary. She had some tissue irritation around her foot, and we've been treating that using class 4 laser, soft tissue work, dry needling. All of those things have been helpful for the irritation over that bunion.
Absolutely, and it's been helping too with the inflammation, because with that bunion, when with as active as I am and I'm constantly on my feet and working out, like that pressure, putting that pressure on it, aggravates it. So when I come in and do the dry needling,
it's like recovery for it.
It is. Yeah. It is. It's like its own little mini, slightly uncomfortable
therapy session. Yeah. No doubt about it. That's kind of what it's actually a really beautiful way of looking at it as it relates to body work and the gym, body work for your muscles, right? I think chiropractor, massage, dry needling, acupuncturist, all those amazing practitioners that are out there, and find that team, right?
Yeah.
Find that team out there for yourself. It's just a great way to stay active and engaged and doing stuff you love to do.
Yep.
All right.
And the people that support you in it.
Thanks for listening to us talk. I'm going to take care of Cass now. Come on up for me, okay? Get comfortable. and relax on in. I'm going to focus on your mid and upper back first. I know
good.
your shoulders are bugging you a little bit coming in
Yep.
today, and I'll definitely take a look at that. We moved this weekend.
What?
We moved.
Oh, how'd the move go?
It was easy.
Good.
Thank you. Shout out to, I hope I say the name right, JK Movers. They were amazing, and they did all the work for us. And it's the first time I've ever paid for movers, and I will always save up if I ever have to move again to pay for movers. They were awesome. And now that we're settled, we're ready to do this thing. We're ready to welcome this next little bunion.
Oh, good.
With joy. I said bunion. I didn't mean bunion. You're not going to be a bunion, Layla. Take a deep breath in. Alright, my hands are a little cold, sorry. And relax. You're good. So that conception about the body too, as well as it relates to the pain, isn't just local here and where we have issues with people getting the wrong type of diagnosis, as well as kind of circling on the mechanistic side of things. It's everywhere. I'm literally in the process of treating someone. It's so cool. I'm excited to work with them. They're just traveling through the eastern United States, and they're from Germany, and they just stopped in because they saw some of the reviews. They saw just kind of the layout, and they said, we're going to go check out these spine specialists and talk to them. And I just had a really nice long conversation with someone who's been diagnosed with things like it's called lordotic curvature. It's basically like a flat back, and like you want to give a good example of why the structure of a spine does not dictate the function. Usain Bolt is a really good, clear example of that. He's got scoliosis, and he's the most elite human being on earth. So you got to take care of yourself. That's the point of that story. All right, keep breathing for me. Easy rest. Let go. Lift your head up a little bit. We're gonna get some extension right here. Okay, here, gotcha. Like this. Good. There you go. Good. Guys, turn your head to your right just a little bit and then settle right there. Loose. Good.
Ow.
Yeah. Good now?
Mm-hmm.
Good. Turn left. Just your head. There you go. Settle. And a little less. Okay, there you go. There you go. Good. And relax. That was pretty good. No curse words. Come on your left side, right side up. Now we'll flip it over this way, okay?
Oh, so you want me to come over the other way?
Please. Where did you travel and hike like that when you went to Europe?
Scotland.
Scotland? Someone else I just treated went to Scotland to go hike. It sounds nice.
64 miles in 4 days.
Oh, really? That's a decent amount.
Dad did it back in June.
Did he?
Mm-hmm.
Oh my God. I won't say how old he is. That's impressive.
75 years old.
Let's go. That's what I'm talking about. Easy.
The man walks 3.5 miles every day.
I mean, dang, if you're going to work hard your whole life and not be able to travel at the end of it, that's what I'm talking about. Get out there and go explore the world. Let this go. Good. On your back. This looks like the symbol for the point in Towson. Relax. Did you have weddings this past weekend?
Yep.
Around here?
Downtown.
Downtown? At
Yep.
least you were inside.
Yeah, the ceremony got moved inside that morning, and I had already kind of figured it was gonna be inside at that point.
Yeah. relax. So our awesome camera woman, Sammy, is now standing on 2 feet over there. And so we're going to be getting some more footage with her. Now that she can move around a little bit.
There you go.
There we go. Get loose. There we go. Good.
I don't know what you're doing, but it feels really good.
So the word, I guess you could describe it as I'm spreading out the metatarsal heads. And I'm working in between that joint right there. I want that to move better for your life, for your feet's life, for your hiking life. There we go. And so I'm just gonna get some of that mobilization going.
For the wedding photographer life.
For that, all that life. Good, and then I can get better movement right here. This is like a midfoot uniform adjustment. Good. There it is. Cool. Another one that works like that. Come on your side, face me. There you go. So we've combined dry needling. She does the physical side of things. We've got fitness and physical therapy here. Oops. Alright, I got you. Relax your shoulders. Good.
Oh, I feel like my bones can breathe.
There you go. You can feel a little pull back here. Good. You might notice like I'm spending a little bit more. There's just a lot of joints to test and check in that foot, as well as, yeah, so it takes me a little longer to kind of work through an ankle, but it's worth it because her foot's moving well, her knees happy, her hips are happy. I mean, heck, if your feet are happy, wedding season doesn't become such a burden, you know what I mean? Hey, open your jaw for me here, Cassie. Good, and close. Feel it again, and close. Really good. Just a little restriction here. Lift your head for me. Good, and rest. And relax. There we go. So you feel compression, gentle release here. Easy, settle. Good, now let it all go. There you go. Good. And now let it all stretch out all the way to your feet. Let it go.
Oh!
Good.
I wasn't expecting that one.
Oh, yeah, it's intense. Okay, you ready?
Okay.
How are you now?
Well,
Let's go shake it out a little bit,
Yeah.
see how it feels. Some of those adjustments, especially when it's a little tighter and bound up, it can be pretty intense. That was an occiput at the end there, so that is intense.
that one felt, yeah, I definitely felt that one in my feet. Oh, just stretch it out.
Good?
Yeah.
Okay. Well, I appreciate you doing a video. 1, thank you.
You're welcome.
2, thanks for that kind words. I hope you feel amazing. I hope you continue to crush it this wedding season. Yeah, I just want to say thank you for that.
You're welcome.
Cool.
You're welcome. I look forward to photographing your family when baby
Yeah.
number 2 comes.
Let's go. Number 2 is on the way. Little Layla.
Yeah.
Oh yeah. All right. Well, thanks. If you have any questions, all right. So a lot of stuff that I did there was a full spine adjustment. I worked on her feet, her hips, her low back, her mid back, her neck, her occiput at the end there. You said outer in a couple of them. I know that's always going to be a question. Was it? Tell me what that means.
It's a good kind of uncomfortable, because when you feel that, you feel so like you're shorter, but then you feel like your bones like get a chance to like breathe. Yeah. And I like when you popped me like one other time before, and I was just like, oh, it's a relief. It only is very uncomfortable for a second, and then it just goes away.
And I'm not trying to downplay that by any means.
No.
From your standpoint.
Mm-mm.
Like,
and everybody is different.
Totally.
Yeah, everybody has a
100%.
different experience.
And I have a different experience with everybody, to be honest with you. And I try to keep it as close to just meeting halfway as it relates to clinical outcomes and comfort for you too. Yeah. But if you're trying to find that person that's right for you out there, realize that it's a little bit of a dance with the person. And you've been wonderful working with me. I appreciate that, and giving me good feedbacks just so I'm just here for you. So it's just. And
you take whatever feedback anybody gives you, so that way you can make them better.
Yeah, let's go. Come on. What are we here for?
Yeah.
What are we doing?
Yeah.
All right. Thanks for watching, everybody. Appreciate it.